The Harvard Global Health Institute says we need to hit about 4 million tests a day. That's kind of the goal that we need to get to. Right now, nationwide, on a good day, I think we're hovering right around 1 million, right? There is a long way to go. How do you start to close that gap? Because we are just not close to that at this point.
So, first of all, I don't agree with the Harvard estimate. I think the Harvard estimate is wrong. It has been changing every month to month, because I just want to point out that it would, there may be a time when we have tens of millions of tests per day, but we know from our efforts in like Arizona and as parts of Florida and Texas that if you do the mitigation steps like wearing a mask, avoid indoor spaces, wash your hands, combined with smart testing, that we have dropped tremendously the positivity rate and the infections. Remember, Arizona was over 20% positive. It's now down under 4%. So we are going to shoot for as many tests as possible that we can have. But I don't want Americans to get discouraged, because we have proof, we know it, that if you do smart policies plus smart testing within the range of tests we have today, we could stamp this out. But you got to do both. So wear your mask, watch your distance, wash your hands.
So speaking of wearing your mask, that's a message that's obviously very important. We have seen, for example, the president, his family members not doing that. Does that send the wrong message to you?
So, the president is in a different situation. He gets tested every day. He is a different individual, and I'm not the president's physician. I'm not going to comment on that. What I want everyone to know is myself, I wear a mask whenever I'm in public. Dr. Fauci, Dr. Birx, all the public health officials really want to make sure that people do that. It's the single best effort that we can do right now until we get a vaccine. Vaccines are really promising, but they're not available right now.
Couple more quick questions for you. Cornell, as we mentioned at the top of this segment, is out with a new study that finds the president is the single largest driver of coronavirus misinformation during a pandemic in which information that is good and accurate is critical. Do you find that problematic?
I haven't read the study. I will go look at it. All I can say is all of us on the task force, myself.
Well, that's the headline, right? The idea that the president is a driver of, I'm sorry, Admiral. I was just saying, letting you know that that's the headline. The president is the driver of misinformation. They looked at a number of articles, analyzed millions of articles to determine this finding. And I'm wondering if you find that to be an issue.
So, I think some things could be taken out of context. All I'm going to say is that I try to give the best public health information. Dr. Fauci, Dr. Birx, we all do. We've been very consistent. No one has ever asked me to alter my public health information. I'm here with you. I'm on CNN all the time. I'm in the Senate. We try to do what's best for the American people. We've been transparent and honest, and we will continue to be that way. You have my commitment on that and all the docs on the task force.
Do you think it would help if the president was more accurate, though?
Look, the president, I think he's come out and said mask wearing is important. I think that's very important. He supported our increasing testing efforts. We just had an effort in the Rose Garden, a new event supporting testing in the Binax test. So he's been supportive of the issues that we need to bring forward. We all need to double down on having better communication, including myself, and we're going to strive to do that. And thanks for having me on so that we can improve our communication to the American people.
And I know we're just about out of time, so I'll make this last one quick. You talk about communication. The task force that you are part of is obviously essential to this. Dr. Redfield, of course, is a part of that. My colleague here at NBC News, Monica Alba, talked with him after she overheard him talking about Dr. Scott Atlas, saying that everything that Dr. Atlas says is false. As we talk about the importance, as you say, of accurate information, referencing things Atlas has said about masks, herd immunity, et cetera. Are you concerned about Atlas's role in this response?
I'm not, because there are differing opinions, even among the science and medical people on the task force. And I think most of us agree on most things. But things aren't black and white. This is a new virus, a new outbreak. We're learning new things every day. There are infectious disease issues, and then there are broader issues of public health, like cancer screening and cardiac effects and substance use disorders and suicides. So I'm not concerned, because we're not afraid of open discourse. The vice president supports open discourse and disagreements. Like he said, he always quotes the proverb, iron sharpen iron. And we do have our disagreements. We discuss it, and we give the best advice to the vice president, who transmits it to the president.
Thank you for checking out our YouTube channel. Why don't you subscribe? It's really easy. Just click on that button down there. And for more news from MSNBC, click on any of these videos here for the latest interviews and highlights. You can get more videos from MSNBC with our newsletters. Head over to msnbc.com/newsletters to sign up.